Have you ever wondered what happens to a medicine after you swallow it? How does it travel through your body? Why do some medicines work quickly while others take hours? And why do doctors prescribe different doses for different patients? The answer lies in one important concept called pharmacokinetics. Pharmacokinetics simply means what the body does to a drug. It consists of four major processes: absorption, distribution, metabolism, and excretion. Together, they are remembered as ADME. Think of drug as a traveler. Once it enters the body, it begins an amazing journey. First, it enters the bloodstream. Next, it travels to different organs. Then, the liver changes or breaks it down. Finally, the kidneys or other organs remove it from the body. This entire journey is called pharmacokinetics. The absorption is the movement of drug from its site of administration into the bloodstream. For oral drugs, absorption usually occurs in the small intestine because it has a very large surface area and excellent blood supply. However, not every drug is absorbed equally. Several factors affect absorption. These include the route of administration, blood flow, surface area, drug formulation, presence of food, and the pH of the environment. Some drugs dissolve quickly. Others dissolve slowly. Some are destroyed by stomach acid before they can be absorbed. The amount of drug that reaches the bloodstream is called bioavailability. Intravenous drugs have 100% bioavailability because they enter directly into the blood. After entering the bloodstream, the drug is transported throughout the body. However, drugs do not distribute equally to every tissue. Some organs receive more blood flow than others. Highly perfused organs, like the brain, liver, kidneys, and heart, receive drugs rapidly. Many drugs bind to plasma proteins, such as albumin. Only the free drug can leave the bloodstream and produce its effect. Some drugs cross the blood-brain barrier. Others cannot. The extent of distribution is described by the volume of distribution, commonly called VD. Metabolism is the chemical alteration of drugs. Most metabolism occurs in the liver. The liver converts drugs into substances that are easier to eliminate. Drug metabolism occurs in two phases. Phase 1 introduces or exposes functional groups through oxidation, reduction, or hydrolysis. This is mainly carried out by the cytochrome P450 enzyme system. Phase 2 joins the drug with another molecule in a process called conjugation. This usually makes the drug more water-soluble. Some drugs become inactive after metabolism. Others become active only after metabolism. These inactive drugs are known as prodrugs. Excretion is the removal of drugs from the body. The kidneys are the most important organs responsible for drug excretion. Drugs are removed through three main processes: glomerular filtration, tubular secretion, and tubular reabsorption. Some drugs are also eliminated through bile, lungs, saliva, sweat, and breast milk. Reduced kidney function causes drugs to accumulate in the body, increasing the risk of toxicity. Understanding pharmacokinetics helps doctors prescribe the correct dose. Patient with liver disease may metabolize drugs more slowly. Patient with kidney disease may eliminate drugs more slowly. Children and elderly patients often require dose adjustments. Drug interactions may increase or decrease drug metabolism. Without understanding pharmacokinetics, medicines may become ineffective or even dangerous. Let us summarize. Pharmacokinetics is what the body does to a drug. Remember the 4 steps. Absorption. how the drug enters the bloodstream. Distribution, how the drug travels throughout the body. Metabolism, how the liver changes the drug. Excretion, how the drug leaves the body. Remember the simple word, ADME. Master ADME, you will understand the journey of almost every medicine. If you found this video helpful, don't forget to like, share, and subscribe to SassMed Visuals. Turn on the notification bell so you never miss our next medical animation. Thank you for watching. We will see you in the next lesson.